no? So I'll take 10 more minutes. Already now it is 12:45. By 1:10 we'll try to complete. I will take 10 minutes of your lunch time. Then we'll finish before that. So when we start this, when the topic is given by our university, future trend, the trend in future nursing research. So I was thinking what I can do, what we can share to the audience. Okay. So the content, what is going to be there in the slides, are completely by my own thoughts and gathering, supporting with some evidences. So with the literatures, I'm going to give my idea how Indian nursing research should be in the future. So that's why we're trying to present for the next 15 minutes. So if we see nursing research, so what is meaning of nursing research? So basically if we say nursing research means that through the process we're trying to answer a question, what we have in our mind, or we're trying to solve a problem, what we're experiencing in our day-to-day life. So that's what the nursing research means. Trying to answer a question what we have, or trying to solve a problem what we are facing in our day-to-day life. So that's what nursing research is all about. If you see the current status, how the nursing in India, all over India, the type of research happening at the UG level and PhD level and independent level when we analyze, so most of the nursing research are focused on this knowledge component. So knowledge, how is the knowledge? And second priority goes to the attitude, how is it? Attitude of something. And third and most widely used research are teaching programs like structured teaching program, planned teaching programs, what is this, self-instructional manual, something like this related to teaching so that improve knowledge and attitude, something like this. This is the current status. Most of the nursing research are focusing on these areas. So next, what is going to be in future? What are we expecting in future is, so as per our experience, I would like to say some 5 key areas where we can focus on the current nursing research. I take this opportunity to thank the leadership of Datta Mage. At least you can consider these 5 focus areas. So because you are being a deemed university, you have the potential and freedom to select the areas, topics which are most important for the current trends. And research, don't think it is a very vast or should be very, we need a rocket science. Please try to solve problem at your hospital or at your college or at your PSC. If you solve the problem, it's a very good research. So try in this area and try to list 5 important areas based on our experience. One could be the cost effectiveness. Research should focus on how to reduce the cost of the current practice. If I am spending 10,000 rupees for a intervention, how much can reduce the cost with the same outcome? Second focus may be related to nurse-led clinics. So that's what our, I think Professor, I think Vice Chancellor sir was sharing in the video, saying that focus more on the nurse-led interventions so that nurses can play an independent role in improving the healthcare system. Third is implementation research. We'll discuss more about it. And fourth could be a digital nursing health interventions. And last, not limited to geriatric nursing research. So I'm not trying to say it's the only 5 area, but these 5 areas could be more important in future, so that the nursing students here and the faculties here and the PhD scholars, they can focus on these areas. First, if we talk about cost effectiveness. So any research, what we're trying to do here is, we should reduce the cost of the customer. Here customers are nothing but all of us, the patients. So patients need to spend minimal amount to get the better outcome. If you see here in cost effectiveness, I would like to discuss about a study conducted in Australia. So where they compared the effectiveness of CPAP. What is CPAP? Yes? Yes, very good. Continuous positive airway pressure plus high flow nasal cannula for an infant with need of respiratory support. So what they did, so they have recruited 676 newborn children and made it into 2 groups. In one group with the CPAP, another group with the high flow nasal cannula. So remember, This study is happened in a non-tertiary care setting where the tertiary care services are little away from the setting, like our rural area. Okay, so based on this setting, which is better, whether CPAP is better or nasal cannula is better, high flow nasal cannula is better. So the final result shows that. So as a primary objective, so when we have the primary support as CPAP, so CPAP plays a superior role, which means the cost of delivering the respiratory support through CPAP is much cheaper than nasal cannula, because the nasal cannula children are trying to go, or they are going to a they are progressing to another way, so they need some kind of tertiary care supports. So they have to transport them, that includes transport cost and manpower cost. When we are comparing all this cost, if you have tertiary care, non-tertiary care setting, if you have CPAP is available, it's better to go with CPAP, so that we can manage the child in a better way with the limited cost. So this is one finding from Australia, because I am unable to, I'm sorry I didn't get much study related to Indian setting. So with this we are trying to compare that one intervention is much cheaper or costlier, so that we can try to practice the intervention which is much benefit to the patients and family members. Second, if you see the most important indicator, that is pressure ulcers. Those who are from hospital NABA setup, they might be know. So they might be knowing pressure ulcer is one of the nursing quality indicators. So what we do to prevent pressure ulcer? Positioning. Positioning is the very important primary nursing intervention. So in any nursing unit, if pressure is developed, which means the nursing care is a very important indicator for nursing care. So what they did in, again, same study from Australia. So what they did here, yeah, can you press next, just next, yeah. So they recruited 78 patients. Yeah. So 40 patients in usual care, and another 38 patients, they invented a device called turning and positioning system. So that is a new device they invented with the cost and with the money is involved. And the traditional usual care, can you go with the next? Yeah. So this is the traditional way what we are doing it. The draw sheets, changing position and maintain the position of the pillow. This is the way they use for 40 patients. In next, this is a machine they invented, that device they invented for turning and maintaining the position. So what is your idea? Which one could be better? Out of these two, second one is better. Why? Why? Yes? So second is better because, I'm sorry, I couldn't hear you. Yeah, spine position was maintained well. But what happened, the outcome of the result is both interventions are equal. Both interventions are equal. Now as a nurse we should decide which is cost effective. Our usual method is very cost effective. We no need to invest money on these devices. But I am telling you current practice. So it doesn't mean that research should do something new. Something involve money. Something involves some extraordinary thoughts. No. Even our existing practices needs an evidence, as sir mentioned here, that can be created through evidences, through researches. So the existing practice is as much as equal to the new device what is being invented. So based on this finding, we promote no need to invest on these new devices. Better we can practice with the existing service, what we are doing it. So the cost involved in that area may be used for other purpose. So this is an example of two studies for cost effectiveness. So what I am trying to tell you here is, the nurses here, scholars here, try to focus on similar studies so that we can reduce cost of Indian patients. How much they are spending for a particular procedure or surgery or something, or for hospitalization, how can we reduce this? So that is the question that we have to think in our mind. Next, if we go to nurse-led clinics, Yeah. So today I would like to say nurse clinics is another important area where we should focus more on, because we are in shortage of manpower. As we know, starting from nurses to doctors to anywhere, we are very shortage. But if you get a super specialty physician to a rural area, it is very challenging for us. But how to manage it? You can see here one of the nurse-led intervention clinic study done in Puducherry about weight reduction. So what they did here, so they recruited 438 patients, participants, 219 in each group, intervention control group. So there the nurse focused mainly on 3 areas. So educating the individual about this weight reduction plus exercise program, and third one component is the motivation factors. So with this, all these 3 components, a nurse could able to maintain or reduce the weight of the individuals or obese individuals. So what we are learning from here is, if a nurse is appointed in this area, the nurse can reduce this obesity by employing this kind of interventions. So this can be independently dealt by nurses. So once obesity is reduced, so that we can manage the obesity related complications. So that way these interventions will be most effective, and we don't want any specific professionals. Nurses are very well can do this kind of interventions. Second example, if you see NCD clinics. So this is about in Chandigarh. So what they did, so NCD is a major problem right now in India, because if you see the government itself focusing more on non-communicable diseases. So previously we are more worried about communicable diseases. That's why fund was more in infectious diseases. Now the shift is changed from infectious to non-communicable diseases. So there the major lifestyle diseases like hypertension, diabetes, nurse-led NCD clinics. So where a small area where a nurse can independently lead a NCD clinic. So in Chandigarh they tried out, which is proved that the screening level is increased. The number of people screened through this NCD clinic are increased. So once we screen, we could able to treat the patients. After treating, we were able to maintain the medication adherence also. So these are 2 important factors of any NCD disease: identifying early, then having regular treatment. So these 2 things are achieved through a nurse-led NCD clinic in Chandigarh, which means we no need of a physician in the remote area, where a nurse independently can screen and promote the medication adherence, so that we can prevent the further complications of NCDs. So this is another great example from India. One is from Puducherry, next is from Chandigarh. Third, if you see here in mental health, so our area, stigma reduction. So this study is done in Rohtak, where all of us we know psychiatric illness. Still, if we talk, people will feel very stigmatized. Okay, people won't come forward for the treatment. So stigma plays again crucial role even today to get the treatment. So what they did in Rohtak, they identified patients with schizophrenia and affective disorders. After getting some treatment, there was a lot of dropouts. People are not coming for the regular treatment. As we know, schizophrenia needs a long-term treatment for minimum 9 months to 1 year to 2 years. If you are not following the treatment for the stipulated period, relapse happens. Once relapse happens, again the duration will increase. So this is a very big challenge in mental health. One of the reasons what we identified is stigma. People are not getting to the hospital. So again, a nurse-led psychoeducation. Here, what the simple technique what they followed is a 30-minute brief psychoeducation at the home. A nurse at the time of home visit, the nurse could educate the patients with schizophrenia and affective disorder. A 30 minutes, a brief psychoeducation. So that psychoeducation improved the concept, that is reduce the stigma, so that the follow-up was increased. So once the follow-up is increased, the treatment adherence went, so that the relapse are prevented. So the 30 minutes of a nursing intervention can play a major role, example in terms of stigma reduction in mental health. So again, this is from India in Rohtak. And last I would like to add here in psychiatry is bipolar disorder. Again, this is a study, a nurse-led study happened in South India, where a nurse designed a program called Family Focused Nursing Intervention. Family Focused Nursing Intervention. So here the nurse at the time of admissions, a set of modules are developed, so that modules are delivered to the families of a patients with bipolar disorder. Main focus is to improve the level of functioning. As we know, in case of depression, the activity will be less. They feel low energy. and they may not do their daily regular activities. So here, in the nursing clinic, what happened? Once patient diagnosed with bipolar disorder, they got admitted. At the time of discharge, before the discharge, a nurse-led clinic where the nurses are trained the family members in this area how to improve the level of functioning of the patients at home. So after 3 months period, they analyzed the level of functioning of the patients with bipolar disorder, and we have seen a very good improvement in the level of functioning. Once level of functioning is improved, definitely their morbidity level also will be reduced. So this is another great example of nurse-led clinics. This is again from India. So nurse-led clinics, again another important area for, I'm trying to tell you for Dadamage University. So where we can focus more on nurse-led clinics so that instead of making an high resource, I can say the physicians or a super specialized person in an area where how nurse can play a role. Again, these are the proven evidences where we can able to manage this with the use of nurse-led clinics. Next is most important thing is implementation research. Okay, so here nurses are a crucial part of an implementation research team. I think all of you know about polio vaccine, no? Yes? Yeah. So you know when the vaccine was invented? Approximately which year? If you Google it, you will get now. Around 1950s, we got the polio vaccine. But when this polio was eradicated, did we eradicate polio? So most of the countries we eradicated. In India also, I think there are no polio cases, but still we are continuing this. But it took around 60 to 70 years, no? So we have vaccine, we identified a vaccine, we invented a vaccine to cure or to prevent the illness, but to eradicate the illness, we spent some 70 years of time. Okay? So, why? So the answer will be through implementation research. Okay? So I think senior people may be aware here, when the polio program was started, it was only polio prevention program. Then in the year 2000, 1997, 98, they made it as a pulse polio program. Pulse polio program. So they changed some changes. So do you know what are the changes in that program? So vaccine is same. What is the meaning of implementation research is, there is an effective intervention is there to prevent a particular problem. But how to implement the intervention is a major challenge. So in the initial program, what we did, just we given vaccine to the less than 5 years old children who are coming to the PSCs and sub-centers. In Pulse Polio program, the process, the strategy is changed, where not only giving it in the sub-center and PSCs, then we made home visits. So where the nurses played a major role, nursing students played a major role. So nursing students go to home visits. Each home they go, identify and mark it at the outside of the compound or door where the child is named. Not only that, then third day, again we went to common places, in bus stand, railway stations. So the whole objective is not even a single child is missed out of this polio vaccination. So the strategy, the implementation strategy is changed because of implementation research. So now we have a lot of effective interventions are there for a particular problem. This intervention. We have evidences are there, but how to implement it? That's a very big area. We are facing a challenge, and now this research is coming up very fast. Implementation research, and nurses plays a crucial role in this implementation research. I would like to share an example from Kolkata, where the palliative care. So all of you know palliative care in cancer is inevitable because people are suffering at the end stage cancer. So, but palliative care is effective in managing end stage cancer disease. But how many people are getting this? That's a question. So what they did in Kolkata, so they did an implementation research. They identified the barriers like this. Why people are not getting this palliative care? So barriers includes, first one is lack of access. They didn't have access to the palliative care service. Then they are not aware. That is unawareness of stage, which stage of their illness. Then lack of affordability. They are unable to get the service because of money and other things. Then transportation to access the care. I may be in place one, but palliative care center is in 40 kilometers there. So I should travel to that particular place. Then we have strict morphine regulations. You cannot get morphine as like you are getting like a paracetamol. So we have a strict morphine regulation is there. And the cultural factors. People feel that okay, this is the end, this is my karma, so I don't know how to do anything, let me die. Let my parents die because of end stage cancer. And last important point here is the medical fraternity, they were highly against giving this task shift from medical fraternity to the rural medical practitioners. So these are the barriers are identified in this implementation research. Not only this, there are few facilitating factors also, like first one is and existing palliative care centers in the cancer institutes. Wherever this is one important point, wherever the cancer institute is there, there we have a palliative center. At least one center is in the institute itself. Then there was a very good network of rural medical practitioners. The group of people, they have very good network. And third one is low morphine cost in India. So the morphine cost in India is much cheaper than other country. And last is family support. So with these identifying factors, what the research is suggesting is involving the network of rural medical practitioners in delivering palliative care at the rural area will be beneficial to the patients with end-stage cancer. So right now what's the problem is people with end-stage cancer are unable to get the palliative care treatment because a lot of problems, a lot of access and transportation, all those things. But through this research we understand that through these existing rural medical practitioners, if we shift the task to them, and there is a high chances for these rural medical practitioners to deliver the palliative care service to the patients who are in need at the rural area. So this is again, morphine is effective in palliative care, but how to implement it, it will be done by implementation research. Here the nurses plays a major role because we are in the implementation area, interventions area. Next comes under digital nursing health interventions. So as we know, without mobile it will be very difficult. So digital health interventions are also important. I would like to share an example of NIMHANS experience here. So what happened in NIMHANS? So dementia is coming up very high. So the incidence and prevalence of dementia is increasing. As we know, the caregivers plays a major role here and they have more burden because of carrying elderly with dementia. So what WHO did, they devised one mobile app called iSupport. So in NIMHANS, we recruited 151 participants. There are 74 participants we involved in the iSupport. iSupport is a WHO application which helps the caregivers to learn how to take care of person with dementia. At the same time, another 77 participants in routine education, generally what we do in the discharge summary and all those things that we educated. In the two areas we divided. At the end of the survey, that is 3 months, what we learned here is 29 participants remained in the group, in iSupport group, whereas only 26 participants remained in the another group, that is general education group. So overall, it has given an attitude is improved. The caregiver's attitude is improved towards caring of person with dementia. However, the major finding of this study is 74 people are use this iSupport in starting. Within 3 months, the number is reduced to 29, which means less than, I think more than half of the participants are not comfortable with the model, online model, that is app. Similarly, in the education also, more than half of the people are not in the study itself. They dropped out. So that area is a major area. So why they dropped out? So that gives a lot of idea to the researchers. We should make a customized, Indianized module. Not the WHO model will not work because half of the people are not following this. So the acceptability is less. So more than 50% are not following this. So this gives an avenue for the researchers. Make an Indianized, culturally Indian culture. If you take India again, different states. Culturally acceptable, even the maybe an online model will be helpful. So that way it gives way to the new researchers. Then another important study, it's related to preterm babies. So another, taking care of preterm babies is a challenge. So what we'll do, we'll keep the preterm baby in a short period in the hospital, then we'll discharge the baby to the home. So the major challenge here is mother, a new mother, a preterm baby, how to take care of them. But still we can't keep the baby throughout the term in the hospital because we have to take care of other patients, other babies also. So in this, what happened in South India, they designed one mobile application. So where the trainings are involved. So the main benefit of important aspect of this application is, so through this application, the mother and ASHA workers are involved. So the mother will be trained and the videos and materials are placed in the mobile application. At the same time, ASHAs are also a part of this application. So mother can learn through the application. Then when the ASHA is going for home visits, the ASHA can observe and enter the information in the application so that the data will come to the tertiary care hospital. So through this application, there was an improvement in the health of the preterm. Because of this, the health of the preterm was improved and the developmental was improved. Because there is a big challenge in preterm. Developments are happened very well and also the follow-up also increased. So these are major things we achieved because of this mobile application. This is another important application developed by nurses. Mobile application developed by nurses. Digital health interventions. Another area. Next. Yeah. So another last area is gerontological nursing research. I think you know about life expectations, no? So what is the current Indian life expectation of a male or female average? Yes? Okay, let's take around 60 plus. So what was in 1947? 80, 90 we believe. If we see statistics, it was around 40. Which means in India, the life expectancy is increased, not only India, all over world. All over world, the life expectancy of individual is increased because of the development in healthcare system. That new inventions in the medicines. So that increase the life expectancy. But at the same time, what happens is people are getting older and older and their problems also getting bigger and bigger. But we don't have a manpower to serve them. If you see Japan, Japan is hiring a huge number of nurses, gerontological nurses. If you are a gerontological nurse, you will be ready to go to Japan actually. So that's the way Japan is hiring because of the increased number of old age people. So one example here is again a study from USA because we don't much study in India. So they try to reduce the delirium through musics. So one of the problem of elderly people in ICU, what they observed in USA is, in ICU, more than 80% of elderly people are developed into delirium. So to prevent the delirium, they try to play some kind of musics. So it may be soundproof headphones or AirPods. Through that, they played musics so that they could able to reduce the occurrence of delirium in the ICUs. So this is one example of delirium. Decrease in delirium through music. Another example you can see here is, yeah, next please. Next, yeah. So this is about depression actually. So that is daily engagement in meaningful activity. So this is another intervention. Because of this intervention, the elderly people develop confidence in maintaining the daily activity. Once they develop the confidence, they have a very better mood and physical functioning. So once these things are there, elderly people can lead a better life than those who are dependent on their physical activity and lower confidence level. So these are a few examples of elderly care. Okay. So with this, I think I'm completing what are the future areas of nursing research. Can we go back to the slide of... So to conclude here, I would like to say the nursing research, as we told earlier, so first thing is volume. We need more number of nurses. Yes, we are generating more number of nurses with use of 5,000 plus nursing institutions. Next is focusing on the quality of education, and next is focusing on the quality of evidence is what we are producing it. So do you have any questions here? So in case of barrier of palliative care, can you scroll down please? That's all.